Welcome to Justice with Dr. V. I'm a doctor and a lawyer. I have a national litigation practice and represent those who have suffered catastrophic injuries. In today's episode, we're going to talk about Depo-Provera and meningioma. Depo-Provera is a birth control medication given by injection. We know causes meningiomas if that woman received at least 4 injections over the course of a year. The risk of Depo-Provera has been figured out that if you've taken Depo-Provera, you have a 5.5 times the risk of developing meningioma compared to women who have not received a year's worth of Depo-Provera. So that's a big risk. We know that Depo-Provera causes mutations, a specific mutation that causes multiple meningiomas. Those are tumors that are in the brain, and they tend to be on the skull base. The skull base meningiomas are those tumors that tend to be harder to get to. If you've used it for over a year, you have at least a 5.5 times risk of developing meningiomas compared to women who have not received that. So your overall risk still is rare, but certainly you don't want to be on a drug that causes a specific mutation. There are plenty of other medications that are available and have been available at all times that you can achieve sterility temporarily. Ever since the 1980s, they've known that meningiomas grow in pregnancy. When you're during pregnancy, you know the placenta is a progesterone factory. So women develop meningiomas, and meningiomas grow during pregnancy. And after birth, the meningiomas, they know, shrink. So we know that the cell line is involved with meningiomas is reactive to progesterone. Women who develop meningiomas often require surgical resection. Women who have surgical resection, they may have reoccurrences. There are women who have had reoccurrences that have required radiation therapy. There are women who have had radiation therapy from meningiomas that then develop radiation-related dementia. There are women who develop meningiomas that can't be operated on because the location is such that removal of the tumor more dangerous than slowly becoming more incapacitated by the tumor. So if you've taken Depo-Provera or a generic for at least 1 year and you've developed a meningioma, you need representation. How are people diagnosed with meningiomas? People who have brain tumors can have weakness of their limbs. They could have visual loss. They could have balance problems. They could have headaches that lead to a diagnostic test. And that diagnostic test is generally a CT scan or an MRI. And the diagnosis is generally made with diagnostic imaging. These tumors tend to be benign. They're often calcified. They tend to be more circular. Of course, you will never know for sure that you're dealing with meningioma until biopsy. Biopsy is usually obtained at the time of resection, but for the most part, you tend to look at it on an MRI and know what you're dealing with. Depo-Provera was developed beginning in the 1970s, 1980s, and was approved in the early 1990s. And it was studied in Atlanta at Grady Hospital, generally been used in African American women. Certainly there are better options, and many doctors stopped using Depo-Provera when it became understood that unopposed progesterone can have complications of osteoporosis and other medical problems. Also, doctors didn't like unopposed progesterone because hormones cause things to grow. When you combine estrogen with progesterone in the form of birth control with estrogen progesterone, they tend to cancel each other out, and you're not seeing the complications related to unopposed progesterone. So when we get a case, we are always evaluating a case to see if this is a case that there was physician malpractice versus pure case against Pfizer and the authorized generics. At some point, doctors should not have been prescribing this medication, and doctors are still prescribing this medication. Pfizer has changed the warnings for Depo-Provera in Europe in Canada, but has not changed the warnings in the United States. But still saying that, doctors do have a responsibility, and we are evaluating every case to see if that's a case that we should bring against both the doctor and the manufacturer. We have cases filed in the multi-district litigation. For example, we have clients that were diagnosed with a meningioma in 2021, over 10 years of Depo-Provera, and they had the tumor resected and they continued on Depo-Provera, and they developed multiple reoccurrences and required another surgery and continued with Depo-Provera. I've taken care of meningiomas since 1996. I'm a brain injury doctor. I testify as an expert on brain injuries, and I've managed hundreds of patients who have had meningioma resections. It's the most common brain tumor, and people who have complications from meningioma resection tend to make it into rehab, and I was a rehab doctor. I've taken care of people who have hemiparesis from meningiomas, hydrocephalus, where they need a shunt for meningiomas. So I understand the chronic complications of this drug, the chronic complications of meningiomas. And I'm a brain injury doctor, and I sue Pfizer for Depo-Provera related meningiomas. These are serious injuries by a very bad drug. Pfizer still is not warning doctors, and there's still women who are receiving this bad drug. This is serious litigation.